Today we have with us Dr. Aswath Kumar, Professor and HOD of Jubilee Mission, Trishul, and he is a gynecologist. And today we are going to have some conversation with him, especially talking about PCOS. Welcome, sir. Sir, so my first question is, first I just want to address whether or not there is a difference between PCOS and PCOD.
See, it's a PCOS means polycystic ovarian syndrome, and PCOD means it's a polycystic ovarian disease. One is the clinical manifestation, and other is just the biochemical theory behind it. Both almost it's the same.
Right. So, when let's say somebody is diagnosed with PCOS, why is it then difficult for them to treat it? And even though let's say they are asked to bring changes to their lifestyle, it's still very difficult and it goes on for years.
So, the thing is that before understanding that, you should understand the basis of the basis behind this PCOS. So the basic concept of the biochemical concept behind PCOS is what they say is insulin resistance. Okay. This insulin resistance, when it is there, that is why it's more common in obese females.
Okay.
Obesity in obese females, the insulin resistance is more actually. So when you say PCOS, to diagnose PCOS, it's a dilemma actually. There are different diagnostic methods to diagnose PCOS. If it's a different criteria. So the oldest criteria what we're using is the Rotterdam criteria, and now we have the PCOS Society criteria. They usually have three criteria. The criteria number one is the patient is having some ovulatory abnormality. That means how does it manifest? It manifests as menstrual irregularity. Second criteria we say is hyperandrogenism. It's the most distressing for a female to have a male pattern of hair. So they have associated hyperandrogen increases. So androgen is a male hormone. Usually females don't have that much androgen levels. When the androgen level increases, what happens? They show male pattern of hair like hirsutism, like mustache, then they'll have beard, then they can have acne, baldness, all this hair fall. All these things are so distressing for a female. And the last is the most confusing criteria, that is ultrasound. So many of the young females come with a report of PCOS without any other features. They have gone for a regular checkup to a sonologist and then they're in. So we should know how to differentiate between a PCOS ovary and a multicystic ovary by an ultrasound. So it's very confusing. So that is why unnecessary young females are labeled at PCOS. To avoid that, the new PCOS criteria, what they have done is that post-menarche, for 6 years, they are not included ultrasound as criteria at all. So if there is hyperandrogenism and ovulatory disturbance in a female, that is what, in a young female, that is what the symptom towards PCOS. And an ultrasound picture shows plus this has indicative of PCOS.
Right.
That is how it is.
Right. So, sir, would that be correct to say that ultrasound is actually a complementary?
Ultrasound previously it was the cornerstone. Now we say now it is only a corner of a stone.
Right.
That is what
right. And sir, now since we are in this topic, what would you suggest for a menstruator to practice to avoid PCOS?
See, the new theory which has come for PCOS is called dysbiosis of microbiota. That's the dysbiosis. They all believe that it is a gut microbiome is the reason for almost all the diseases. So we all have a healthy microbiome. To explain it, we have two type of microbiomes, good and bad. So our intestine or the gut contains both good and bad. Usually it is in a balance. So then this balance is disrupted. So how it is disrupted? Unhealthy food habits. Unhealthy food habits, oily food, sweeteners, and other drugs, other things which will disrupt the microbiota. That is called dysbiosis. It's called the dogma theory. Dysbiosis of gut microbiota.
Right.
So what happens is that when this microbiota changes, it causes inflammation to the epithelium of the gut and it causes leaky gut syndrome. where this bacteria, harmful bacteria enters and it produces lipopolysaccharides.
Right.
Later the patient lands up in what I told you, insulin resistance.
Right.
This insulin resistance is the most important. That leads to all the hormonal changes and features of PCOS. Now you would have understood. So that is the reason why all females in the young age group, the adolescent age group, should practice healthy lifestyle.
Right.
Healthy lifestyle means two things. What are the two things in healthy lifestyle? One is exercise and the other is healthy food habits.
Right.
So have good vegetables, fruits, all in avoid artificial sweeteners, more sweets and oily foods, junk foods especially. The youngsters are, you know that
Right.
they are crazy about junk foods. They have to decrease their, and exercise is a must. They have to at least do 150 minutes of exercise per week.
Right.
Or 45 minutes per day for at least 5 days continuously. It can be hard or soft, whatever way you can say the exercises.
And sir, to the last part of our conversation, if I were to ask what is the biggest misconception of PCOS, what would that be?
The biggest misconception, there are myths of PCOS.
Of course.
Nice question. See, we believe that, many people believe that only obese females have PCOS. See, obesity and PCOS, it's not correct actually. The insulin resistance is manifested in lean females also. There is a big category called lean PCOS. And the other myth is that all PCOS female land up in infertility. So once an adolescent 18-year-old female diagnosed with PCOS, immediately first question the mother will be asking is that, oh, she can have children or not. That is also wrong. Many PCOS patients, without treatment also, they can become pregnant.
Right.
Another thing is that this hyperandrogenism, it is not necessary that hyperandrogenism, all these features should be there in PCOS. So there are phenotypes, A, B, C, D, they have documented. In B, C and D phenotypes, they don't have any ovulatory disturbance or any
Right.
menstrual irregularity, but they are PCOS.
Right.
Other group, they didn't have any hyperandrogenism, but they are also PCOS. So these myths are
Right.
have to be clarified actually
To be
and cleared.
busted. Right, right. Okay, sir. Thank you so much, sir.
Thank
It
you,
was a
thank you
very
so much.
insightful conversation. Thank you.
Thank you.